Hey, everybody. Happy Wednesday night, day whatever. It's 94 days since the first case of COVID-19 was found in the United States. It just seems like it's going on and on. But with the protests, it means people are really tired of being home. They're bored, they're scared, but they're chomping at the bit to get out. And I am too. I went over and visited my parents today, and my mom's clearly getting better, and my dad is even better still. And people who follow my work know I'm like a huge fan of hyperbaric oxygen. And we took a portable chamber over to his house, and it has helped him just be cognitively sharper, more himself. When you have pneumonia and you're 90, it can really take a negative impact on the oxygenation to your brain. And so it's one of the things hyperbaric oxygen does is it increases oxygenation to the brain, and it also has been shown to help your lungs get better oxygen as well. So tonight, our phones just started ringing off the hook on Monday. And one of the most common reasons call is people have bipolar disorder. And so I thought what I would do tonight is talk about bipolar disorder and coronavirus or COVID-19 and how they may interact with each other. So if you know somebody with bipolar disorder, you might want to send this to them, either text them and let them know it's on now, or I'm going to post it. You can send it to them then. And here we go. So what is bipolar disorder? It used to be called manic depressive illness, and it basically means people cycle from manic periods where they're up to depressed periods, and there's often normal periods in between. A lot of people get diagnosed with bipolar disorder and they really don't have it. What they have are the chronic effects of a concussion or chronic effects of a traumatic brain injury that damages one or both of your temporal lobes. So bipolar disorder is characterized by severe changes in mood, energy, and activity levels. These shifts are more severe, obviously, than the normal ups and downs, right? We all have ups and we have downs, but we don't have ups where we don't need to sleep for 4 days and still have plenty of energy. We don't have ups where our speech is pressured and we never let anybody else talk because we have to say so many different things. Nearly 6 million adults in America are affected by bipolar disorder. So manic and depressive disorders that shift in cycles. So the symptoms of mania: abnormally elevated mood. I mean, you're just way happier than is normal for you. You don't need to sleep. Your energy goes way up. You can become grandiose. You might think you're a spy for the Russians. Now, there are spies for the Russians, but if that's not really your training, you need to be thinking about bipolar disorder. Racing thoughts, where they just go so fast, it's really hard for you to catch them, and other people around you see what you have is distorted or disjointed thinking. Poor judgment that leads to risk-taking behavior. You can become hypersexual, hyper-religious, spend money you don't have, and then that cycles. So not everybody who has to file for bankruptcy has bipolar disorder, but it's one thing to be thinking about. Did you make those bad decisions when you were in a manic episode? Sometimes, oftentimes, people with bipolar disorder can become paranoid. They can have delusions. They might hear voices that aren't there or see things that aren't there. So that's whenever we say, psychiatrists say psychosis, that's generally what we mean. You lose touch with what's real and you might have delusions or hallucinations. And so there are these discrete periods that they don't last hours, that generally last weeks or even months. And then it might cycle to normal, or it might cycle to depression. And it can be a dangerous depression with suicidal ideation, really sad, dark, negative thoughts, feelings of hopelessness, helplessness, worthlessness, sleeping too much, or this thing that often goes with depression, early morning awakening, where you go to sleep okay, but around 1:30 you're up and you just can't get back to sleep. Decreased concentration, decreased energy, and suicidal thoughts or behaviors. So with the coronavirus pandemic, all of these symptoms may be exacerbated. So how can you cope if you have bipolar disorder or if you live with someone who has? So the first thing, it's important to get an accurate diagnosis. And there's other things that can cause this, like Lyme disease. Or if you read Susan Cahalan's book, Brain on Fire, she had something called an autoimmune encephalitis, where her immune system was actually attacking her own brain. Or, as I mentioned earlier, it can also be from a traumatic brain injury. So what can you do to keep bipolar disorder under control during isolation? Don't stop taking your medication. If you're bipolar and you're on lithium, or you're on Lamictal, or you're on Trileptal, or Abilify, or whatever your medication, if it's working for you, do not stop it. So talk to your healthcare provider to see if you might need an adjustment, but don't stop taking it. Keep stress under control, because stress can be a major trigger for bipolar symptoms. And I've given you lots. Look at my anxiety talks, stress management practices, meditation, hypnosis, deep breathing. When hopelessness hits, understand it isn't just you feeling this way right now. It's normal to feel scared and depressed in a pandemic. So I've often said during this pandemic that mental hygiene is just as important as washing your hands. There's a question about childhood trauma and any link to bipolar disorder. Childhood trauma is clearly associated with mood disorders, and bipolar disorder is technically classified as a mood disorder. Genes only load the gun. It's what happens to us and our behavior that pulls the trigger. So childhood trauma can exacerbate a lot of things. Does marijuana have any effects on bipolar disorder? Yeah, it can actually make it worse. The studies that I've seen, plus the imaging I do, has shown, yes, can calm things down in your brain, but it can also make you anxious. It can also make you paranoid. both of those things can disrupt it. Teenagers who smoke pot, according to 2 studies from Norway, have a 450% chance of an increased risk of psychosis, of developing psychotic thought disorder. Teenagers who smoke marijuana have an increased risk of anxiety, depression, and suicide in their 20s. So I'm not a fan. If you're prone to paranoia and psychotic episodes, know the triggers and avoid them. So you may need to stay away from social media, turn off the news, or unsubscribe from breaking news alerts. Stick to reputable sources for updates, like the CDC, I like Johns Hopkins, Mayo Clinic, and try to only check it twice a day. When I don't check the news, I'm just so much happier. When you're feeling manic, as I said, it can lead to feelings of hypersexuality, feelings of being invincible and overspending. Now is not the time for any of it. Have a plan to deal with this if you start feeling a manic episode coming on. And almost all mental health providers I know are doing video conferencing appointments. They're either doing telemedicine over the phone or they're doing it over Zoom or FaceTime. So when you think things are off, it's so important to talk to your healthcare provider. What if your support group can't meet? Schedule a video conference so you can still get the support you need. I have to tell you, I'm really over the term social distancing. It's a bad term. It's physical distancing. You need to physically be 6 feet or 10 feet away from others. I want you socially connected, because when you socially distant, you're more likely to get depressed and you're more likely to have any underlying vulnerability, panic attacks, obsessive compulsive disorder, bipolar disorder, much more likely to get triggered in isolation. There's a question of SPECT and bipolar disorder. What we often see in a manic phase is this pattern I've described called the ring of fire, where there's just way too much activity going on, and that cycles. In the depressive phase, there's too little activity going on. So keep all of your appointments. Don't skip appointments just because you can't meet in person. You can switch. And this is going to be a big disruption. You know, I tell my team at Amen Clinics that the Chinese symbol for crisis, which is what we're in, is 2 things. It's a combination of danger and opportunity. And so the pandemic's a dangerous time for a lot of people. You hear me talk all the time about my parents. But the opportunity, it's disrupting medicine, and in a good way, where all the laws have changed around telemedicine, where you're going to be able to talk to your doctor over phone, which means you're not going to have to fight the traffic, which is really good for pollution, especially here in Southern California. And then Amen Clinics is here for you during this time in all 8 of our clinics. We have clinics in Bellevue, Washington, Walnut Creek outside of San Francisco, Encino, north of Los Angeles, Costa Mesa, Orange County, the North Shore area of Chicago, Atlanta, Washington, D.C., and Manhattan. And we're all open and scanning and taking care of people. And I think now is just the most important time, because the next pandemic that is coming is a mental health pandemic because of the chronic stress the whole world has experienced. But I don't want it to be mental health as usually practiced, which is why I wrote my book, The End of Mental Illness. It was actually really interesting, and I was thinking about it. The idea behind the end of mental illness is these things aren't mental, they're brain. That one idea changes everything. Get your brain right, and your mind will follow. And if you want to get your brain right, you have to prevent or treat the 11 major risk factors that steal your mind. That's a huge part of the end of mental illness. And we created this mnemonic, Bright Minds, and those are the 11 risk factors. So, for example, B is blood flow. Low blood flow is the number one brain imaging predictor of Alzheimer's and associated with depression, ADHD, addiction. And one of the things that increases the risk of low blood flow is having hypertension. And hypertension is actually one of the risk factors for COVID, for you to really have a bad time fighting off that virus. Retirement and aging is the R in Bright Minds. And the older you are, the higher the risk for you to have cognitive problems, brain problems. I told you about my 90-year-old dad who, when he had COVID pneumonia, he just wasn't thinking like he usually thinks. And that's why I like hyperbaric oxygen so much. But retirement and aging, another risk factor for you to have a bad outcome with COVID. The I in Bright Minds is inflammation. When you have inflammation in your body because you have a high sugar diet, your gut microbiome isn't healthy, you have low levels of omega-3 fatty acids, or you have gum disease, when you have inflammation in your body, you have a higher risk of both depression and dementia. You have inflammation in your body, you're likely to have a worse outcome than others from COVID-19. The G is genetics, H is head trauma, T is toxins, M is something called mind storms. The I is immunity and infection. So if your immune system is hyperactive, so for example, you have MS or you have rheumatoid arthritis or Crohn's disease or celiac, and then you get COVID, your immune system is overreactive and may overreact too much to the virus. The N is neurohormone deficiencies, but the D is actually the bad one with COVID, which is diabesity, where you're either pre-diabetic or diabetic or overweight or obese. And obesity and diabetes are two of the biggest risk factors. And the problem is, why do we have so many cases of death in the United States? 50% of the population is either diabetic or pre-diabetic. 60% of us are hypertensive or pre-hypertensive. And 72% of Americans are overweight. 40% of us are obese. And I'm about to publish 2 new studies that show as your weight goes up, the actual physical size and function of your brain goes down, which should scare the fat off anyone. So the end of mental illness, getting physically healthy to really nourish your brain, is going to help you be mentally healthy, but it's also going to help you fight off this bad virus that is going to be with us for a while. So if you're struggling with bipolar disorder, ADD, anxiety, depression, relationship problems, learning problems, we would so love to hear from you. You can learn more about us at amenclinics.com, and I hope these chats are helpful for you, and I will see you soon. Take care.